Welcome to our weekly research insight for the inner circle. Today, we are discussing a topic that is fundamentally important to everyone in this room: the relationship between social media and muscle dysmorphia. We will be doing a deep dive into a brand new 2025 study by Ganson and colleagues. This research gives us a critical, evidence-based look at the digital environment our clients, and we ourselves, navigate every single day. Let's begin. So, why this study? Why now? Because the conversation around social media needs to evolve. For too long, we've only talked about screen time as the main variable. This research, as we'll see, moves beyond that superficial analysis. It looks at the specific type of content we consume and how it affects us. More importantly, it connects this content directly to a serious mental health condition: muscle dysmorphia. This is not just about body image issues. It's a clinical condition characterized by a pathological preoccupation with not being muscular enough, leading to significant distress. Finally, and most importantly for us, this study doesn't just present a problem. It gives us the data we need to create practical, evidence-based strategies to protect ourselves and our clients. It's about building mental resilience alongside physical strength. Before we get into the details, we will break down the study using the PICO framework. This is a method we use at the Academy to systematically deconstruct research. P is for population, who was studied. I is for intervention, or in this case, exposure, what were they exposed to. C is for comparator, who were they compared against. And O is for outcome, what was the result we measured. This framework allows us to understand the essence of a study quickly and clearly. Over the next few slides, we'll examine each of these components. Let's start with the population. The researchers gathered a large sample of 1,553 participants. This group consisted of boys and men from Canada and the United States, with an average age of about 24. A key detail here is how they were recruited, through advertisements on Instagram and Snapchat. This is both a strength and a limitation. It's a strength because it targets the exact population that is using these platforms. However, it also means the findings are specific to social media users and may not apply to those who are not on these platforms. The sample was also noted to be diverse, which helps make the findings more robust. Now for the intervention, or more accurately, the exposure. What was being investigated? The researchers focused on 3 specific categories of muscularity-oriented content. They asked participants how often they had viewed each of these in the last 30 days. First, images of muscular, lean, or athletic bodies. This is the idealized physique, the end goal that is constantly presented. Second, content related to muscle-building supplements like whey protein. This represents the socially acceptable, commercialized path to achieving that physique. And third, content about muscle-building drugs like steroids and SARMs. This represents the illicit, yet often discussed, path. Together, these 3 cover the spectrum of content someone with a high drive for muscularity would likely encounter or seek out. So, who were these individuals compared to? This is the C in PICO. In a statistical analysis like this, you need a baseline for comparison. The researchers created 2 groups for each content type. Group 1 was the high-frequency group, those who saw the content often or constantly. Group 2 was the low-frequency or reference group, those who saw it sometimes, rarely, or never. The entire analysis hinges on comparing the risk of the high-frequency group to this low-frequency baseline. It's all about relative odds. And finally, the outcome. What was being measured? The primary outcome was probable muscle dysmorphia. It's crucial we understand this term. This was not a formal diagnosis from a doctor. Instead, The researchers used a sophisticated algorithm built from several validated questionnaires. This algorithm is designed to identify individuals who meet the core clinical criteria for muscle dysmorphia. 1. A preoccupation with being insufficiently muscular. 2. A pathological drive to get bigger that interferes with life. And 3. Significant distress or functional impairment caused by these concerns. It's the most effective way to assess for a condition like this in a large-scale survey. Let's walk through the research process. First, they recruited the 1,553 participants online. Each participant then completed a detailed survey. This survey collected data on their background, their daily social media use in hours, and critically, the frequency of viewing the 3 types of content we just discussed. They also completed the questionnaires used for the muscle dysmorphia algorithm. The final step was the analysis. Using a statistical method called logistic regression, they calculated the odds of having probable muscle dysmorphia based on content viewing frequency. A very important point here, they controlled for other factors, including total daily social media time. This means they were able to isolate the effect of the content itself, separate from just being online a lot. This makes their findings much more powerful. Now we must critically evaluate the study's quality. This was a cross-sectional observational study. Its main strength is that it's the first of its kind to link these specific content types to a measure of muscle dysmorphia that is based on diagnostic criteria, and it does so in a large, diverse sample. However, the limitations are significant. Because it's a snapshot in time, it shows a strong correlation, but cannot prove causation. It's possible that viewing this content increases the risk for muscle dysmorphia, but it's also possible that men who already have muscle dysmorphia are more likely to seek this content out. This is called a bidirectional relationship, and it's likely both are true to some extent. The other key limitation is that the diagnosis was probable, not confirmed by a clinician. We have to keep these limitations in mind when we interpret the results. Let's translate this into what it means for you as a coach. The key takeaway is that your client's media consumption is a significant variable in their psychological health. If a client is expressing frustration, or if their body dissatisfaction seems disproportionate to their actual progress, their social media feed could be a major contributing factor. The study shows that viewing content about supplements and especially drugs is a red flag. When clients go online for information, they are exposed to content that this study links to a higher risk of pathology. The most important point, it's not about how many hours they're online, but what they're looking at. You can be the best coach in the world, but if their social media environment is toxic, you're fighting an uphill battle. Opening a dialogue about their social media diet is no longer a soft skill. It's a vital part of evidence-based coaching. Now let's turn this inward and talk about what this means for us as athletes. The data is stark. Your social media feed has a direct, measurable relationship with your mental health. Frequently viewing idealized muscular bodies was associated with 3.78 times higher odds of probable muscle dysmorphia. Let that sink in. For supplements, it was 2.65 times, and for drug-related content, it was 3.62 times. This isn't just numbers, it's a quantification of risk. What this suggests is that the constant stream of perfect physiques and the products promoted to achieve them can warp our perception of what is normal and attainable. It can normalize a level of focus that borders on pathological and can increase our own body dissatisfaction, even when we are making excellent progress. And this happens regardless of how many hours we log online. This slide looks technical, but the concept is simple. Grade is a framework for grading the certainty of evidence, like a report card for a study. Observational studies like this always start at low certainty because they can't prove cause and effect. The risk of bias is serious, mainly due to that cross-sectional design we talked about. However, we can also increase our confidence. Here, the researchers found a very strong association. Those odds ratios of 3 to 4 times are considered a large effect size in public health research. This strength boosts our confidence, so we add a point. The final verdict is low. This does not mean it's a bad study. It means that we can be confident there is a real association here, but we must be cautious about saying that one thing causes the other. It's a strong signal that we need to pay attention to. So, who can we apply these findings to? This is generalizability. The results are most directly applicable to the group that was studied, boys and men, roughly between the ages of 15 and 35, who are active on social media platforms like Instagram. Geographically, it's focused on North America. However, the underlying psychological principles, things like social comparison and internalization of ideals, are likely relevant across most Western cultures, including here in the Nordic region. So while we should be careful, we can reasonably assume that these principles are at play in our own environments as well. Theory is useful, but action is better. This slide offers a 5-step recipe for managing your social media environment, which you can use yourself and teach to your clients. Think of it as mental hygiene. First, audit. Take 15 minutes and consciously evaluate how your feed makes you feel. This is your data collection phase. Second, curate. Be ruthless. Unfollow or mute any account that consistently makes you feel anxious or negative. This is your intervention. Third, diversify. Actively seek out and follow athletes with different body types. Follow experts who focus on performance, health metrics, and technique, not just aesthetics. This broadens your perspective. Fourth, question. Before you engage with a post, pause and ask yourself if it's genuinely informational and inspiring, or if it's potentially detrimental to your mindset. Finally, limit. Use the tools built into your phone to set time limits. This isn't about restriction, it's about increasing your awareness of how much time you're actually spending. For the coaches, here is a practical checklist of questions you can integrate into your client check-ins. You don't have to ask all of them every time, but they can help you open the door to this important conversation. Asking what kind of content they're seeing gives you a window into their digital world. Asking if any accounts make them feel anxious gets directly at the problem of negative social comparison. Asking where they get their information helps you gauge if they're relying on evidence-based sources or questionable influences. And asking how they feel after they close the app is a powerful way to assess the immediate psychological impact. And always bring the focus back to the most important comparison: them versus them. Their progress is measured against their own starting point, not against the curated highlight reel of a stranger online. To summarize who this research is for, it directly applies to male athletes and the coaches who work with them. It is critical information for anyone interested in the link between online content and body image. Equally important is knowing who it does not directly apply to. This study did not include women or girls, and while they face immense pressure from social media, it often manifests differently. For example, with a focus on thinness ideals rather than muscularity. The findings don't apply to people who aren't on social media, or necessarily to cultures outside of the West. And finally, this was a general population sample, not a clinical one, so the dynamics may be different for those already in treatment. Good research answers some questions, but more importantly, it raises new ones. This study leaves us with several open questions that will drive the next wave of research. The biggest is causality. Which way does the arrow point? Does content cause the pathology, or does the pathology drive the content consumption? It's likely a feedback loop, but we need to understand that better. Content nuance. Does it matter if you're seeing a post from a friend a top-level pro, or a paid ad? Almost certainly, but we need data on that. Platform. Is the experience on a video-first platform like TikTok different from an image-first one like Instagram? And finally, protective factors. What makes someone resilient to these effects? Is it media literacy, a strong support system, high self-esteem? Identifying these is key for prevention. These open questions lead directly to the future research agenda. To solve the causality puzzle, we need longitudinal studies that follow people over time. Think of it as watching a movie instead of looking at a single photograph. We also need studies with clinical samples to see if these findings hold true for men with a formal, doctor-provided diagnosis of muscle dysmorphia. Most excitingly for us, we need intervention studies. This is where we could test a program, like the mindful feed recipe, to see if teaching these skills can actually reduce the risk of developing muscle dysmorphia. And finally, content analysis to pick apart the specific images, words, and cues in social media posts that are most strongly linked with negative outcomes. As we wrap up, I want to leave you with 3 clear, actionable takeaways from this research. First, content is key. The conversation must shift from how much time we spend online to what we are viewing. The type of content is a stronger predictor of risk than total screen time. Second, the association is strong. The link between viewing muscularity-oriented content and a higher likelihood of body image pathology is not small or insignificant. It is a large, statistically significant effect that we must take seriously. And third, action is possible. This is not a message of doom and gloom. It is a call to action. Both athletes and coaches have the power to take active steps, to curate their environments and have open conversations to mitigate these risks. That concludes the formal presentation. We've covered the study's design, its findings, its limitations, and its practical applications for us as coaches and athletes. I now want to open the floor to you. What are your thoughts? Do these findings resonate with your own experiences or what you see with your clients? Please leave a comment.